Good afternoon, everybody. Can you hear me okay? Thank you for coming out. My name is Jesse Ruzicka. I'm a VP of Sales at Abarca Health. I appreciate you taking a few minutes of your day to listen to how a payer can take control of their pharmacy benefits. So I'm going to talk about a virtual PBM model, but before I do, show of hands, I know this is a technology conference and I'm going to talk a little bit about technology. How many of you are familiar with pharmacy benefit management? Okay, more than half. All right, good. So I have an audience who at least knows kind of what we're talking about, so I appreciate that. All right, so a virtual pharmacy benefit management platform is one that, when created correctly, can actually forge new partnerships with health vendors. It can create aligned incentives, and ultimately, the goal is to lower the cost of healthcare. And that's really what I want to talk about. I want to talk a little bit about the role of a technology partner in the pharmacy space. So, first of all, I want to talk for just a fleeting moment about Abarca Health. So it gives you a little bit of background of who we are and what we do. We have a mission. Our why or our purpose is to find a better way in healthcare, and specifically our niche is pharmacy benefit management. We were born as a PDP 16 years ago and currently serve as a licensed claims platform across 5+ million lives. All right? So our mission is one where we create a seamless and personalized experience for the patients. And we do this by influencing providers, pharmacies, and certainly all the various health data vendors to create this opportunity for us. So we have 5.3 million lives on our platform. We process about $8 billion in drug spend per year. We have a net promoter score of 70, which we're very proud of. And we have 100% client retention since our inception 16 years ago. We consider ourselves a healthcare technology company who happens to be a pharmacy benefit because of our scalable platform. We're primarily in the government space. We have business in Puerto Rico and 11 states. We have employees in 26 of the lower 48. So Abarca is a different kind of PBM. And for that reason, we're here to talk about that. We're here to talk about our technology and why it matters. In a space, in an industry that is loaded with the majority of the prescription claims through 3 large vendors, we have found a niche market that has given us the ability to win and retain clients. We believe that we are different and we are strategically aligned in a market that is very much consolidated. We are the only scalable, cloud-based, virtual pharmacy benefit administration or pharmacy benefit management company in the country. We leverage APIs to do so. So many of you representing technology in the room today would have the ability to connect into our platform. And one of our culture visions is off-road. We think creatively, we want to do things differently. And we'll talk a little bit about vertical integration and how we can break away from that. As Abarca Health, we are not owned by a health plan. We are committed to embracing the virtual pharmacy benefit administration model. We're well capitalized and we're funded by our growth. So before I transition to how we kind of break away, let me share with you what I think the opportunity is for you in the room. We believe that health plans want interoperability. They want the ability to plug and play with different vendors. They want vendor portability. And ultimately, they want control over their benefits, okay? So when we think about the role that technology plays, we believe it's 3 things, and this is what Abarca Health strives to do, right? We believe the role of technology is to create scalability and extensibility. We believe that the role of technology in this space is to create agility and enable the connections like we're talking about today. And finally, we believe that it's important for technology companies to create value on behalf of their clients. And that is our approach. That is our business value, and that's what we're striving to do. So the summary that interested you enough to come here was about a virtual PBM revolution. And what does that mean, and what can we be doing differently? So I want to talk a little bit about the influencers that are going to drive that change, and then the role that you can play. And we choose the word revolution purposefully because we need to start something different. I already mentioned to you that the 3 largest PBMs have 75% of the prescriptions in the United States. The largest 5 medical companies manage greater than 70% of all medical and pharmacy claims. And one more statistic for you, more than half of all medical health spend goes through the largest 7 entities. And so the opportunity for many of you in the room, for many of the companies that are here, is on a smaller scale to be connecting with partners that can actually influence that change. And we believe as Abarca Health that we are a disruptor that's going to make that change. So some of the drivers that are influencing the market right now include oversight and regulation from the FTC as an example. There's a wave of regulation when you think about PBMs, pharmacy benefit managers, and what our Congress is asking of them is more transparency. That is a simple example of how a change will occur. You have government regulation. There's a lot of market consolidation. I gave the example a moment ago of how much spend is going through pharmacy plus medical or the largest 7 entities. So we're seeing a lot of consolidation. You see on the news how health plans that own pharmacy benefit managers are now buying provider networks for billions of dollars. They already own the GPOs, the group purchasing organizations that own the rebate with the manufacturers. So we're seeing a lot of consolidation. I think that's going to influence the PBM model. We're also seeing a shift to different pricing models. So today, much of the pricing models are an A to B discount and rebates. We're starting to see more pressure on the rebate model. We're starting to see more accountability, more value-based. What does that drug do for my patient? Is there a risk-sharing opportunity? And then finally, we talk about tech-enabled pharmacy. There's a whole conference center right now of people who have created companies that are influencing the providers, the pharmacies, the patients, the consumer themselves. And so we're seeing this movement right now that's allowing for that interoperability. And then finally, we're starting to see now, all of us have phones in our pockets. We have computers that are driving the consumer to make better decisions. And I believe that these are the key influencers that are going to influence the PBM model. So what do I mean when I say virtual PBM? Virtual pharmacy benefit manager is one where a payer replicates some of or all of the services of a full service PBM. So they will bring in-house some of those capabilities. And you can see on the left side some of the capabilities a pharmacy benefit manager needs to have to be a PBM. They need to manage a network, they need to manage specialty pharmacy, they need to manage formulary rebate structures as an example. Many PBMs own their own mail order pharmacies, or maybe they have clinical programs. So when thinking about a PBM, those are some of the core competencies required. So what is the benefit of a health plan or another payer taking on some of those or all of those responsibilities and doing it for themselves? It actually allows for them to have alignment with their own goals and essentially maybe able to partner with companies who they're not then competing against. All right? So they'll have flexibility in the control and the purchasing of the contracts. They'll have control over their benefit and plan design. They'll have control over the network and the pharmacies and the specialty pharmacies as examples. And again, I said earlier, companies want to create value. They want the agility. They want enablement of services. Being their own virtual PBM allows them to do that. So the virtual PBM model is one that Abarca Health actually lives by. We are a virtually vertically integrated PBM. By that I mean we do not own our own specialty pharmacy. We do not own our own mail order pharmacies. Instead, we contract with 63,000 retail pharmacies and a mail order pharmacy. And we actually use a best-in-class RFP process for our selection of specialty pharmacies. In the course of doing business for our 5+ million lives, we have a handful of things that we've learned that I'm sharing with you today as you're thinking about how can we regain the cost of pharmacy as a payer. First of all, you must have an aligned strategic vision. When you work with a large PBM who is vertically integrated completely, you lose the ability to contract with who you want. So you may have to use their specialty pharmacy when there are alternate specialty pharmacies to consider. It's very important to have an aligned vision of what you're looking to gain at the end. So you want to be able to think about how would you contract that. You also want to ensure that your partners have the technology that allows for that interoperability. I stated earlier we're heavy on APIs. We have a library of connections today of 120 different APIs across about 50 different pharmacy benefit modules. It's really important to make sure that the partner that you're working with has that technology capability. The examples that I've shared here include some clinical programs with companies that you may have heard of. So you have the ability to choose who can help you to control some of those pharmacy costs. You also want to understand your partner's strengths and weaknesses. When partnering with them, they should be filling your voids. They should be complementing what you're doing, right? You want a partner who's going to enhance your value proposition in the marketplace. And finally, I mentioned the role of technology is one to create agility. Partners must be aligned. They must ensure that their product technology and their roadmap allows for the creation of creative ideas and design. Sounds simple. The reality is a lot of partners out there will not allow for that connectivity. I believe that's a really important piece of putting together a pharmacy benefit administration or pharmacy benefit management company. So I mentioned earlier some of the key responsibilities or competencies required of a PBM. Again, they're listed across the top. You can see them. It's not simple to be a PBM. There's a lot of claims processing related to benefits, testing, formulary management is significant today with rebates, networking, contracting, the audits and the regulation required. Abarca offers end-to-end service. We can check the box of every other PBM and do everything for you. Alternatively, we will sell our services modularly, and you can buy into claims processing, rebates, clinical programs as examples. On the bottom, you can see a little bit about our technology. I've shared some of it already. We have 99.95% average uptime. We have 100% cloud-based. We have been tested to greater than 1 billion claims per year. We're currently managing about 110 million claims per year. And we built off of a modular API connectivity. So when considering a virtual PBM or a virtual pharmacy benefit administration company, you want to think about all the different offerings. When considering that for yourself, you want to think about, well, what pieces can we handle as our own payer, and what would we want to license out to another company? So finally, when we think about kind of the next generation of healthcare, you must consider the entire patient's medical experience in order to really create kind of that lowest total member cost or the lowest cost of care for a member. So again, I want to walk through just a couple of examples of what the technology should do for you. So first of all, it's creating that total cost of care experience. So consider the medical data. Consider the pharmacy data, which is the most utilized benefit. Medical data is the most expensive as of now. Pharmacy benefit is the most used in volume, but there are some cell and gene therapies that some of you may be losing sleep over coming to market, already have been in market, that are going to literally cost millions of dollars a year. So you need to think about a healthcare technology company that considers those things. Second, it must allow for on-demand connectivity with pharmacies. It must connect, including retail and mail. It must connect into disease management companies. It must connect into other providers that have the goal of lowering those outcomes or lowering the cost and improving the outcomes. To reduce the spend, the data must be actionable. This is kind of a third insight. Lots of data. You have data from the wearables. How many people are wearing an Apple Watch or something similar, a Fitbit, right? You have data from wearables. You have pharmacy data. You have electronic medical records. Those are just a handful of examples of ways that data comes in. You have pharmacogenomic testing or biomarker testing. So what we want to do is we want to have the center, the platform that can house all of that information, all of that data, and then make it actionable on your behalf. And that's how you're going to lower the cost of healthcare. That's how you're going to make people healthier. And finally, you have to have vision, you have to have scale, you have to have agility. And when we think about all the different things, those data points and the action that can be made from those data points must be connected back to the patient, they must be connected to the payer, they need to be connected with your alternate healthcare vendors. And so that is why you need that alignment. So I want to end on my last slide talking a little bit about Darwin. Darwin is a Abarca Health claims platform that I've been talking about a little bit. Again, it's 100% cloud-based, and it's a technology platform that today processes pharmacy benefit claims. Again, we can house all of the data from your other vendors in a way that makes sense and create reporting and analytics off of it. It was built from the ground up to be intelligent and flexible and scalable. Cloud-based with 2 servers in the United States allows for us to scale plus or minus depending on a client's needs. The interoperability philosophy is our core philosophy. We have the ability to connect your strategic vendors into our platform. The APIs are the way that we do that. We have embeddable member apps with a single sign-on that, again, allow you to connect. From a real world experience, think patients, think claims. One of your members is calling in. Our customer service reps can see all the information. One login, multiple screens. They can see formulary impact, they can see letters that went to the member, they can see retail experience, all in one place. And ultimately, the data set, once it's on a platform, becomes actionable. It becomes an event that the platform reads out and gives insights that can be acted upon. And we believe those are some of the examples of things that make Darwin different. I have just a couple minutes left. I'd be happy to answer any questions. If not, thank you very much for coming out.